Good afternoon, doctor.
Good afternoon, sir.
Congratulations for having the Cristal Pro, the latest cryotherapy device from Deleo, France.
It's my pleasure.
Doctor, you were using already the topmost brand of the world. What made you look at Cristal Pro?
So it was patient's demand. There's like, doctor, put two machines together if you can. We don't have 6 hours for one area. So I was thinking what can be done. And then you came up saying that you can apply 4 probes in just 60 minutes, my treatment will be over. And they were very happy when I discussed with them. And it gives a better temperature. Like I can choose a temperature in this.
Yeah.
I can choose -10, I can choose -12 degrees Celsius, and I can choose the vacuum in it.
Yeah.
In previous machine, I could not choose the vacuum, it was fixed. So depending upon patient tolerance, I can change the vacuum pressure, I can change the temperature, and that's what made me choose this. So what happens is, if the patient don't have 6 hours for one area, they'll do 1 or 2 cycles, then they'll come after 4 weeks, they'll do another 2-4 cycles. But then the result doesn't come as good as what we want. Here what happens is, all the 4 cycles are done together. So the results start showing in the entire area together. And it is more appreciated because all the area apoptosis happens together. The fat freezing has happened together. So results also start seeing together. In previous, we had to, struggle. Then we have to first 2 cycles happen 1 month back. Another 2 cycles happen after 2 months back. So the overall result, we had to wait to see for 2 months to 3 months.
True. Madam, whom do you feel that could be the right candidate for Cristal Pro? And is there any adverse event, or is there something, some protocols or something to be followed before coming for the treatment? If you can give a insight about that.
Every adult who walks into my clinic can be an ideal candidate because it works from smallest pouch of fat to the biggest area. So like anybody who has a bit of double chin and tired of doing dieting, done every exercises, but it's not going. There are certain people who are born with certain type of body type where they are very lean, but they have extra fat pouches around their waist, around their hip, maybe around their arms or around your lower bra strap area. So not necessarily that you have to be very obese to be a candidate for this. You can be very lean and still can be the candidate for this machine.
So do you suggest for the obese also, because in India, though we look for maybe within 30 BMI, but patient with 34, 35 also may come and ask for it.
So here I look into that whether patient is motivated, how well motivated and how much he understands when I tell him how the result comes and how much effort he also has to put in. Then with the concern from the patient, that we tell them, even if your BMI is 32, 34, 36, we can do this, but you need to promise us that you'll be following rigorous diet, rigorous exercise along with it. Ideal BMI is 30, 32. That's what company promotes. Yeah.
So
answering to your question, second, that was your query that what is the contraindications for this. So first, pregnancy. Second, hernia. Third, there are people who are allergic to cold.
Okay.
They might have cold urticarias or they have cryoalbuminuria. Those are diseases in which patients are not supposed to be in cold environment.
Okay.
These are few most common contraindications. Rest is okay. So regarding your third question, what are the adverse events? More than millions of treatments have been done.
Right.
Most commonly what is encountered is bruising, which is expected. Maybe some amount of delayed pigmentation, that also temporarily goes off. Some amount of tenderness and pain in that area, which also goes off in a few weeks' time.
Okay.
That's very normal.
So what all post-treatment things you recommend usually?
So post-treatment care, there are 3 to 4 things they need to keep in mind. Cristal Pro freezes the fat cell.
Right.
Then it dies on its own, but we still need to drain it.
Yeah.
So the draining happens via lymphatic system. So they need to do a bit of massaging in that area more frequently. Try to eat healthy. Try to drink 4 to 6 liters of water every day because that will help to cleanse the dead cells faster.
Right.
And don't gain weight.
Yeah,
most importantly.
Most important.
So what we do is when patient comes in, we measure their weight. Because sometimes the Cristal Pro has worked, the apoptosis happened, but patient is already over on gained weight, so they say we did not see the result. So be on the same weight. If possible, try to do weight training along with it so that muscle building also happens and the result is overall. And eat healthy. It's seen that if you follow intermittent fasting, that also helps in apoptosis of the fat cells. So that is also recommended.
So food and exercise is equally important.
Yes, most important. It is an additional measure to take off the localized fat. It just doesn't take away the entire body fat. So there are fat locules which will not go even with exercise, even with diet. On those localized fat cells which are stubborn, that is an area where we need to focus.
Is there a second treatment required for this Cristal Pro?
So number of treatment at a given point differs patient to patient. Some need 1, some need 2, some need 3. Because if we apply a Cristal Pro probe or a cryolipolysis probe at any given point, it kills 30% of the fat cell at that point. If you're happy with that much amount of fat loss, it's okay. But if you say, no sir, I want to reduce further, then you can go for a second cycle, which will again add in 30%, third cycle, which will again add in another 30%.
Okay.
So it's your choice, because it's not maths here, it's patient who is, if he's happy in that contour, if he's happy in that curve, it's okay.
Everybody has their
Fat
own...
is needed. It's not that everybody has to be, flat and
there
all.
Is nothing fixed.
Yeah. So it's if your contour looks nice with it, you're happy with one also. One of the best feature of this is doesn't have any downtime.
True.
It's a lunch break procedure. Patient can come, get the procedure done, go back to the work. No downtime, no pain, no anesthesia, no side effects or risk of any surgeries, which is normally seen with liposuction or any other procedures.
But people prefers non-surgical procedure most of the time.
But we need to choose the patient correctly and we need to align them what they are expecting out of it.
Thanks, doctor, for your time.
Thank you so much.
And I feel the inputs which you have given is going to be really, really useful for those who are looking for non-surgical body contouring.
Pleasure is mine.
Thank you very much.
Thanks
a lot.
Yeah.